joining us from Rothman, and I love him. All right. In fact, I know he's rooting Phillies because he is the incredible doctor for the Phillies, and of course, he is one of the best. He's the chief of sports medicine for Rothman, Dr. Michael Ciccotti. Doctor, good morning.
Hey, Anthony.
Go Phils, baby!
That's right. You got it. That's right. It's the best time.
It is the best time. I know you're excited. It's fantastic. First of all, I just want to thank you guys because you guys are amazing. I have countless stories of how Rothman has helped us weekend warriors, including myself. I told Dr. Penowitz helped me get through my Achilles injury. And friends, knees, hips, I mean, you name it. You guys put us back in action.
Well, thank you for that. I mean, I would tell you that, we're so honored to be able to take care of people. And, you spoke to it that just so much goes into these issues and problems that occur, and doing research to make better the treatments that we have so that we don't always have to treat things with surgery. We can treat them non-operatively, and your testimony to that, that's what it's all about. So we're so honored to be able to do this for people and get them back in the field.
Yeah, and you guys are amazing. And it's so easy for, some people to prescribe, well, we got to do surgery. And it's like, no, let's exhaust the treatments that are right for you, that we think. And, it's about the patient. That's how I always feel, man. It's truly amazing.
You're spot on, Anthony. And I would tell you, just from my time taking care of the Phillies for 30 years, I would tell you that probably 95 to 97% of the injuries are very well treated non-operatively. And that's really part of this. So you're right, like just doing what you can for an athlete to get them back onto their playing field, onto the court, onto the slope. That's what it's all about. So it's very humbling and exciting for us, but and to get to take care of these athletes that do this most amazing things, right? It's just incredible.
Now, I know we're going to talk about Christian McCaffrey and what's going on with him, but I gotta switch up just a second with you. The beauty of today's medicine and today's care and the what's going on is that we now can be athletic and active into our 50s and 60s and even 70s. It's amazing what's out there.
It's incredible. And again, in the 30 years I've been doing this, I've seen it evolve from, very, now when I look back, sort of primitive ways of treating these things. And now it's just incredible. You spoke about with your Achilles tendonitis and some of the non-operative treatments to increase blood flow, biologic treatments, and there's so much research focused on it and understanding what athletes do. It is just incredible what these athletes do, the stress they put their bodies through. And we tend to think of it in very tangible ways, musculoskeletal ways. It's torn, it's damaged, we have to repair it. But one of the other things that's really important here, whether it's Christian McCaffrey or it's AJ Brown or it's Devontae Smith or Lane Johnson, any of these athletes, particularly thinking of the Eagles, it's not just the musculoskeletal part, Anthony. It's like the psychological part. Like if you love what you do, right? You love what you do. So imagine if I said to you, you cannot do this for 6 months. And you know what that would do for you, right? The emotional, psychological impact of having someone who can do something at the highest level, and then they have to stop for a period of time. So we as researchers and medical providers are learning about the psychological aspect of it, getting these athletes, keeping them in their game while they're rehabbing, whether it's from surgery or not, and then preparing them to get back. And so the psychological part of it is maybe one of the most amazing things more recently that we focused on in terms of sports medicine.
That's fascinating. It's interesting because you talk about the evolution, and you guys at Rothman where I was just talking about research. You're always about the research and about the forefront of the technology. Think about it. ACLs, we talk about Achilles. They were death knells to athletes. You got an ACL injury, you were done. You got an Achilles injury, forget about it. You had no chance of coming back.
you're spot on, Anthony. Like, these were career-ending injuries, and now, and I say this literally all the time to athletes, you have to think about this as being career interruptive. Okay, it happened. We're going to navigate you through it, and we got to keep you prepared. We're going to do everything we can that's allowing the body part that's injured to rest and heal. We're going to do everything else that keeps you in the game so that we can get you back as quickly as possible to the way you were before. So you're right. Career-ending injuries, those things were career-ending. You know, you were a pitcher and you had a bum elbow and your career was over. And now, if you have a UCL tear, you get a Tommy John surgery, and you're good to go in a year. And obviously, you know, not everybody, but 90+% of these athletes are back. So it's pretty incredible.
I always had a question about Tommy John. Why is it that pitchers come back and their velocity has that dramatic increase?
I love it. That's great. So, I mean, that's sort of an urban myth, I'll be honest with you.
Okay.
But, I mean, maybe not, no, not, you know, not actually, but what the pitcher remembers is what happened yesterday, right? So the months leading up to the injury, as they're slowly, progressively like damaging this ligament, their velocity does tick down. And their control, they become less accurate, okay? They lose control. So that's what they perceive. And then they go through the surgery and they return to a velocity that's better than they were right before the final event. So they perceive that their velocity is better, their control is more precise. But also, what goes, and this is another part of an amazing part of sports medicine, is that during the time frame that they recovered, we work on that. We're not myopic. We used to be myopic. You injured your elbow, we fix the elbow, and we rehab the elbow. But we realize that sport involves your entire body. And so a pitcher that has an elbow injury probably has some shoulder tightness, probably has some core weakness, probably has some lower extremity weakness. And so we work on what's called their kinetic chain. You may have heard that phrase before.
Yes.
And so we focus on their kinetic chain. So we actually optimize them. They come out of a recovery period and their entire kinetic chain is better. Their body's better. So they may be achieving higher velocities. Their control may be more precise because they're now better holistically. They're a better athlete. Does that make sense?
Makes perfect sense. Actually, it's like ding, ding, the light just went on, and it completely makes sense. I have to laugh. I have an 11-year-old who is a baseball player, 11U player. And like, so I'm around all these parents and, you know, the subject, there's parents that are getting like preemptive Tommy John surgery for like young baseball players. And now I'm thinking that's ridiculous, right? Because what you talk about is exactly right. When this stuff goes, the whole body, the connectivity of it is really what drives them.
I mean, you're touching on another incredibly important topic. You know, we live in this country, Anthony, where like the moment that a baby exits the womb, they have to decide what sport they're going to play, right? And the idea of sports specialization. I mean, you just had Larry Boa on, right? Like, Larry Boa is an amazing athlete, but he was a great athlete in all different sports. Like, he didn't focus on just baseball, you know, when he was, like a sixth grader. I mean, he was playing all kinds of sports. So these athletes played multiple sports. And then we've now in this era of sports specialization, and it's like, you can have the most beautiful car, but if you drive it all the time, the tires are going to wear out. So these athletes that play different sports, they use different parts of their bodies through the year. And they didn't fatigue the way the athletes now. So you can have a chronologically young athlete that is physiologically old because they use their arm all the time, 12 months out of the year, over and over and over. So you're speaking to all kinds of things that are really a big part of sports medicine now.
I got to tell you, I could talk to you all day. You are fantastic, man. You really are. I can't wait to talk to you next. I really enjoyed it. It's so interesting and enlightening. I got one thing to say to you. Go Phils, my brother. Go Phils.
Thank you very much, Anthony, okay?
Thanks, brother. We appreciate Dr. Michael Ciccotti, who's amazing.